A nice study comes from the Columbia Center, the National Center on Addiction and Substance Abuse. This is Herb Kleber's group, who used to be the former director of NIDA, the National Institutes of Drug Abuse. College students have a higher rate of alcohol or drug addiction than those of us in the general public population. Nearly 23% of students meet the medical definition for alcohol or drug abuse or dependence. And by dependence, I'm meaning a compulsive use of a substance, despite the fact that bad things happen to you when you continue that way. And as you can see, that is considerably higher than the general population at large. White students are more likely to use drugs and alcohol than minority students. Nearly half the students that were surveyed in this CASA study in 2000 said they use the drinks or the drugs to relax, reduce stress, or to forget about problems. They're self-medicating. Here's something that is becoming increasingly more prominent, the use of painkillers and also, by the way, stimulants. And I'll show you a study that just came out 2 days ago for the first time. Okay, so you can see from that first bullet point that opioid-like analgesics like Percocet, Vicodin, OxyContin are really becoming much more common on most campuses throughout the country. I will tell you that my guess is that for the year 2010, that has at least doubled, In 2007, among teens and young adults 12 to 25, 1/3 of those who use illicit drugs say they recently have abused prescription medications. 6% had abused prescription drugs in the last month, and we'll talk about where they get that. Also, smoking marijuana seems to be on the rise as well. And the percentage of the students who are using other illegal drugs, like cocaine and heroin, seem to have gone up as well. So it's not a very reassuring study. The binge drinking part has increased, and I think you're going to find it even higher for the year 2009 or 2010. And as I mentioned just a minute ago, about 85% of all arrests seem to involve alcohol. It's a most difficult problem. Okay, here's another college alcohol study that just came out a couple years ago. This is what we call a meta-analysis. Namely, it's a summary of a number of important studies that have been done over the last 10 years. And I'll only point out a couple of things. 44%, again, there's that figure, 44% reported binge drinking. But here's some of the other issues that really are, unfortunately, comprise the problem with drinking. These students are more likely to miss class, they're likely to be failing, they're less likely to be studying, and their grades are lower. They also, are, as we just indicated, are more likely to get in trouble with the campus police. And as we mentioned earlier, too, they get themselves involved in intimate relationships that are extraordinarily self-destructive, if not self-defeating. It's not surprising, then, that the colleges that have the highest level of binge drinking have the greatest levels of sexual assault. 60% of the binge drinkers, according to this meta-analysis, met the criteria for alcohol dependence. Of course, 25%, and that's part of the illness, namely denial, denied that they had a problem. We do know that banning alcohol on campus or dormitories does reduce binge drinking, but there are some challenges in that. And we know that fraternity and sorority members in some campuses seem to be at much greater risk. Many of you knew about the initiative that took place about 4 years ago, led by one of the college presidents at Amherst, in an attempt to get his peers to to decrease the amount of alcohol usage by lowering the age to 18 from 21, because he felt that when it was 21, it encouraged more binge drinking. A lot of people felt it was a stupid idea, not the least of which was Mothers Against Drunk Driving. But some colleges began to look at this issue. And it's an interesting anecdote. The University of Iowa began to schedule more classes on a Friday morning and afternoon to curb drinking. I have a nephew who went to a Northeastern university that'll go unmentioned, Syracuse, and Thursday night was a drinking night for the kids up in Syracuse. That's when the partying started. So this was an interesting attempt. The other thing that I will tell you about is the use of drinking games. And a small study from the University of Texas at Austin followed a small group of people about what do you do when you reach your 21st birthday and you're a college student. And you can see from the bullets below what happens. These celebrations can be life-threatening. Arguments, fights, not knowing where you were, having unprotected sex, hangovers, blackouts. Average of 12 drinks for men, 9 for women at your birthday celebration when you're 21. So there are a lot of rituals that have become integrated into campus life, not in all places, but in some of them. Why am I concerned about this? Well, because we finally have the neurobiological evidence to indicate that, in fact, when you put that stuff in your head, it does do some damage. So we're looking at now through functional magnetic resonance imaging, which is a real-time way, non-invasive way to see the metabolism that goes on in your head. So we're able to compare those students, for example, who have been drinking drugs with those who are not, and we're beginning to see certain kinds of deficits. DTI is diffusion tensor imaging, which is a special kind of imaging that shows you the white tracks, the white matter tracks, and we're beginning to see abnormalities in these kinds of things. We're beginning to see that if you do neurocognitive, the testing of students who are bingers, you will see that they don't remember things very well and they can't learn very well. Very important, because if you can't learn and remember, learning and memory is the key to everything that who we are, what we know about ourselves and the world around us. If anything interferes with that, we're in trouble. Marijuana use is the same, and also ecstasy, which we have come to appreciate, unfortunately, can have some very, very, very devastating long-term effects when people use it more than once. Big time. We used to think that everything was done at the age of 5 or 6. Nothing could be further from the truth. The brain matures. But the thing that I want you to see is that the last part to come online is the part up there. You know what that part up there does? That's the one for critical thinking, executive functions. That's why alcohol is bad. That's why kids get in trouble. Are graduate students different? Well, they are in some ways, and you can see from the slide that's in your packet as well, there are some unique kinds of stresses that they face in a much more intense way. This is by no means a small population. You almost got 600,000 international students enrolled in the United States, although that number is declining recently, but it's a substantial part. And you can imagine that they have some unique kinds of things coming from their home country in Asia or Europe or where it may be. So what are some of the ethical problems? How do you really respond to suicidality? You know, what about mandatory versus voluntary interventions? Suicidality is a grounds for suspension. You all have followed in the last 6 years the debacles at George Washington University, Hunter College, NYU, MIT, where the immediate knee-jerk response by administration was to throw a kid out of the dormitory and out of the campus. Big mistake, because then the kid loses all sense of the support system he has. He becomes embarrassed and ashamed. So we have moved from a cover your position to trying to see how can we help a student in trouble rather than dismissing him. Now, I'm not saying that there aren't times when you do need to dismiss a student, but I'm telling you the knee-jerk response to students who are severely depressed has to be examined.